Good morning. This is day 3 of Bill Howatt. I'm talking to you today about mental health and COVID-19 with Conference Board of Canada. And the purpose of today's conversation is to continue just to have a chat with you. As I said before, this is not meant to replace mental health treatment or to be a form of psychotherapy or anything other than just Bill Howatt having a conversation with you to provide some ideas. And today, what I want to spend some time thinking about is the word calm. As I look at the news and think about it, as I'm sitting in my apartment in Ottawa in isolation, like most people are, stepping back and thinking about what does self distancing mean and self and isolation. And the first day or two is okay. Now we're starting to get our minds around. Well, we might need to do this for 7 days, 14 days. It could be longer, and you're going to hear all kinds of stuff. People talking about social distancing. And what's cool about this concept of social distancing is that some people right now, like myself or someone else, could potentially have the virus, and sitting here, we could be getting better. And eventually, they're going to come up like they are in the UK with a test where people who may have it will be able to get tested and they'll be able to establish that they're fine, and those folks can start going back to work. So there's going to be all kinds of creativity so that we can start helping people that are not at risk to be getting back to help keep our economy going, and people who are at risk figuring out how to mitigate their risk to prolong and reduce the risk on their healthcare system and reduce the risk for folks. I was talking to my mother last night, who's 85 years old, who's on, every day does, not every day, but every day thinks about her kidneys, and she has to go on dialysis twice a week in Prince Edward Island. I was thinking, my God, Mom, you need to make sure that you do X, Y, and Z. And we were talking back and forth about the pattern, about how important it is for her not to get sick at this point in time. And my brothers and all of us are all working on that. And one of the things that comes to mind is the concept around it's important now to practice calm. And when you think about calm, I like using mnemonics in my head to help me learn to try to break it down so it has some meaning to me. Is like calm to me when I start thinking about the word calm is a C stands for caring. Caring for ourselves and caring for other people. When we start, as a person has been in all kinds of crises in my life, I'm quite fascinated with myself. Even in my personal life, sometimes I can be, upset and get stressed out. But when I get in my work mind and I start realizing my job is to take care of other people, and I walked into crisis. I've been around when World Trade happened, and things in Swiss Air and other things. And it's amazing if we're caring for other people like it's a parent and your child's in trouble, and we start thinking about caring for others and ourselves, that can have a calming effect. The A is to anticipate you're going to get news that could be frightening and upsetting. And what I try to get people to be thinking about is anticipate there could be some bumps and say to yourself, yeah, the next couple of weeks can be challenging. It may be hard. See, what's different in our culture is we're very much binary, like there's good and bad. If you talk to the Dalai Lama, not that I ever have, but if you have listened to him enough to say that, I might get the sense he would say that in our culture, we haven't really had the word misery brought into our culture, where it is not always positive and it's always negative. There's a gray, and some of us not actually learned how to live in misery. And guess what? For some of us, the next couple of months might be misery. But the good thing is, in these times, we've all had challenging times where we're being in a hospital for a week or we've had something happen. Is that if we can close our eyes and go to that point in time and realize that the time has passed and we got through it. And so we can anchor ourselves in some positive memories to realize even in miserable times, as hard as it is in the moment, that there's usually where we can get out the other side. So anticipate the next little while could be hard. If you are, that can help you get a sense of calm because some things may not be perfect. Things could be a little bit harder. Kids could be a little bit upset. I mean, the navigating children home for the next 60 days for some families is going to be a big challenge in keeping them entertained and keeping your job and all that stuff. So anticipate and realize that this will pass. May not pass by next Tuesday. 2 weeks, 3 weeks, 4 weeks. We don't know. We'll know a lot more in 2 weeks than we did today. So let's just stay calm. The L is listen. Listen to reliable resources and learn. And be open to learning different ideas. It's because just because we don't know things doesn't mean we're not possible. And I'll say that a lot over and over. And the same thing is even myself, I'm a Luddite. I don't know anything about technology. Here I am doing a video and they've taught me how to do this kind of thing. So this is quite amazing. We're all going to learn some different things. And hopefully one thing we can learn is some gratitude for what we have in our lives and realize that this moment may be a point in time for us not to take so much of our life for granted. And then the last part, the M in calm, for me is monitor. Monitor how you're doing and monitoring if your levels of anxiety and monitor your levels and pay attention to it. I'm going to probably do some talks on anxiety and burnout and parenting and relationships and even intimacy and all these different things and addictions and suicide and different topics as we go through that are appropriate to talk about to be able to be helped. But the thing is to be monitoring. So if you think about your C and your A and your L and your M, it's think about from perspective is that our brains, our emotional brain, a lot of it's unconscious. So there's going to be all kinds of thoughts be flying up on you. And when you get those emotional thoughts, sometimes that hardwiring can drive emotions and fear. I talked a little bit about fear yesterday, and what I'd like you to kind of think about is one of the things about calm is starting to use our frontal brain, our big cerebral cortex, and start programming our brain, talking to people, and start paying attention to what we're doing. So my lesson, my idea, and my suggestion for you today is calm. I know it doesn't sound probably intuitive for, or maybe it is intuitive, but I, the right word I'm trying to get out is it's not easy. I know that, and that's what I'm trying to say. I know this is not going to be easy. It's very real at this point in time. However, I believe if you think about what I said around the C and the A and the L and the M, and we started to bring that to our forebrain and practice it. The great thing about neuroplasticity about our brain is wherever we put our attention is whatever we focus on will expand. And it's kind of like running 5 miles. You don't run out the door and go 5 miles. You get tired pretty quick. That's how your brain is. You'll take some time. And if we start to work on developing our mental fitness, it can evolve and grow. It takes intention though. So that's my talk today. We'll see you tomorrow. Know that we're thinking about you. Know that we want the best for you. And we'll be back and we'll chat soon. Take care.